Our next speaker is Dr. Jeff Patterson, who's a professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health in Madison. And there he maintains an active family practice and teaches residents in family medicine. He's a board member of the group Physicians for Social Responsibility, or PSR, and once served as the organization's president. PSR is the U.S. affiliate of the International Physicians for the Prevention of Nuclear War, which was awarded the 1985 Nobel Peace Prize. Dr. Patterson has traveled extensively in the former USSR, visiting Chernobyl and sites of nuclear testing and nuclear weapons production, and has lectured about the effects of nuclear weapons and radiation in the former USSR, in Europe, and in the US. His special interests include the medical effects of radiation, nonviolent alternatives to war as a means of preventing war, and also sustainable methods of ameliorating climate change. Let's welcome Dr. Patterson.
Thank you very much. Thank you. It's always great to be in Chicago, and it's especially good to see so many people here on a Saturday, and young people as well. I really appreciate that. I often think sometimes it's us gray-haired folks who are running this stuff, and so it's nice to see young people here. And the gorillas. Are the gorillas still here? They were great. And I'd like to thank our colleagues from Japan for their very inspiring messages. It certainly drives me again to do more, and so thank you very, very much. I wanted to talk about some of the health effects of radiation, and I represent Physicians for Social Responsibility, affiliated with the International Physicians for the Prevention of Nuclear War. We're 50 years old. We started back in actually 1991 and 1961 and 62, and we published the first article on the medical consequences of thermonuclear war in 1962 in the New England Journal. And so we're celebrating that today, and we hope to have a follow-up article now 50 years later. This was quite significant because the public really didn't know much about the effects of radiation and the effects of nuclear weapons at that time. Thanks to the secrecy of the nuclear weapons establishment, or the nuclear industrial complex that I'm going to talk about. And this really projected that into the foreground, and at that time we found that children's teeth had strontium-90 in them from nuclear testing, and then subsequently that led to Kennedy and Khrushchev signing the above-ground test ban treaty that put testing underground. PSR sort of went into hibernation along with protesting and thinking about nuclear weapons until the late 70s, early 80s, when Dr. Helen Caldicott came along and rebirthed the organization, and has certainly been a stalwart soldier in this thing that we've been dealing with. And I thought too, when I joined at that time, we'd have it done by now, and how little we knew, huh? So here we are today, and I think the forces are even stronger than they've ever been in the nuclear industrial complex. There are three fundamental issues that I want to talk about today. One is there is no safe dose of radiation, and I'm going to talk about that and what happens medically with radiation. Two is the nature of the nuclear industrial complex. It is really powerful worldwide. And three is, what is the reality of radiation releases that we face today, all the way from medical irradiation, which is probably the biggest source of radiation that we get, to nuclear weapons, to nuclear power plants, to the entire nuclear fuel cycle. So first, let's talk about the nuclear industrial complex. The nuclear industrial complex was born out of nuclear weapons. Intense secrecy around it. The Manhattan Project in this country, the Soviets following suit not too long after that in developing their nuclear weapons, and then the blossoming of the Cold War that ultimately led us to have 50,000 nuclear weapons in the world. We've now gotten rid of half of those, and we've got a long ways to go. And then Eisenhower came along and developed the concept of the peaceful atom. And the peaceful atom was supposed to supply us with electricity that was too cheap to meter. We saw a slide earlier about this. And in fact, quite the opposite has happened. It's really too expensive to meter, and so the nuclear industrial complex has to figure out all kinds of ways to hide the cost, the real cost of that. And we're not going to talk much about cost today. But nuclear weapons and nuclear power go hand in glove. One doesn't come without the other. And if we look at countries today that are pushing nuclear power, the United States, Britain, France, Russia, China, India, Pakistan, countries that are getting rid of nuclear power, Japan, Germany, Switzerland, Egypt, maybe. We'll see what happens with the new government there, and perhaps other countries. What's the difference? The countries who are pushing it all have nuclear weapons, all have nuclear weapons, and they're desperate to continue this. It goes hand in glove in many, many ways, all the way from the fact that we are buying highly enriched uranium from the Russians' weapons industry to run our nuclear power plants. And I had a talk the other day, and a gentleman said, well, that's a good thing to use up that highly enriched uranium. Yes, on the one hand, that's true, but on the other hand, it really is taking costs away from the nuclear power industry as well. It's cheaper because it's already made, the stuff's already made. And we look at India and Pakistan, both of who are non-signatories to the Non-Proliferation Treaty, and both who developed nuclear weapons out of their peaceful nuclear atoms program that we supplied, both the training and the reactors and the light water, et cetera, for. And, you know, we put India on the bad list for a while. We wouldn't cooperate with them, send them any more nuclear power plants. And now, because Westinghouse needs the money, we now signed a huge agreement with India, and we're once again supplying them with nuclear reactors, even though they won't let us into their weapons complexes. So there's tremendous hypocrisy here. And instead, we worry about Iran and we worry about North Korea, and granted, they are of concern. But how many of you know that North Korea shot a rocket off the other day? Okay, and it was a liquid fuel rocket, didn't work, didn't go anywhere, whatnot. They may test another nuclear weapon soon. They may have 2 or 3 nuclear weapons. How many of you know that India shot a ballistic missile off the other day? Quite a difference, all right? And India shot a ballistic missile off that worked perfectly and is capable of hitting Beijing and other cities, and may even be capable of coming to the United States. Their ballistic missile program, despite the fact that they're non-signatories to the Non-Proliferation Treaty, is fully capable of delivering nuclear weapons to Pakistan and other countries. And yet you didn't even hear about it. Wasn't even in the press. Here we are looking at North Korea with this little microscope. You know, oh, they're terrible, terrible. And yet we have this development of a huge ballistic missile program and nuclear weapons program in India and Pakistan, which have come very close to nuclear war twice, and we'll talk a bit more about that. Well, I like to think of the downfall of the nuclear industrial complex because they have 3 poisonous Ps. These are the poisonous pills that they carry. One is price. And as was mentioned, the cost of these plants is getting so astronomical that the former head of Exelon, who just retired recently, said 3 years ago, and then just shortly after retired, there's no future for nuclear energy because it's too expensive. And then we hear about stocks being sold. We know where the money goes. Pollution, and we are going to talk about that quite a bit today, and then nuclear proliferation, which is tied in together with this. We cannot separate the two out. The hallmarks of the nuclear industrial complex are secrecy, and we've heard about some of that already, cover-up, and minimization. You keep it secret, you don't let it out, and that started in the roots of the development of the nuclear bomb back in the Manhattan Project, perhaps for good reasons, and continued on, both the Russians and us, and it continues today, both in the nuclear power and the nuclear weapons components of the nuclear industrial complex. If you can't keep it secret, then you cover it up. And we see that over and over again. This isn't really a big problem. We put some dirt over it. Rocky Flats, for example, supposedly safe, and yet we know plutonium is still in that soil and still migrating in the water there. And then if you can't cover it up, then you minimize it. Okay? This leak is no harm to human health. How many times have you heard that? Over and over and over again. Okay? Well, I think Jay Leno, and I don't know how many of you like Jay Leno anymore, but Jay Leno probably hit this right on the head recently with this vignette.
occurred in the steam generator tubes of San Onofre's reactor number 3.
No danger to the public, no danger to our workers.
Did any radiation leak out?
If there was any
Well, sometimes a little satire is good for us in terms of pointing out the truth. Anyway, we've all heard this many, many times. You know, there was this leak, but no harm to human health, no harm to human health. Well, we don't know that unless we watch the effects of this for years and years and years. So it's a ludicrous statement. There is no safe dose of radiation. How do we know that? Well, David Lilienthal, who was the first head of the Atomic Energy Commission, now the NRC, said it's a great privilege to be alive at a time in the world's history when a discovery akin to finding fire electricity comes along. There used to be 3 R's that everyone had to learn, read and write and arithmetic, and to this we must now add a 4th R, radiation, and that's true. The Beer report, Biological Effects of Ionizing Radiation, a huge government report that has several reports. Its last report in 2005 said low doses of radiation, there's a direct linear relationship between dose and development of solid tumors. There is no safe dose of radiation, even background radiation. And this is probably the best document. It's a thick document, a little nighttime reading if you have insomnia. But it certainly has held up well. Now you're going to hear lots of counter-arguments that low-dose radiation is good for you. Hormesis is the thing, that it actually builds your immunity. And we'll mention a couple things about that in a few minutes. But there is no safe dose of radiation. There's no free lunch. A single exposure is sufficient to increase cancer incidences years later. And we're seeing that in the Hiroshima and Nagasaki populations now, where we're still seeing new cancers at rates that exceed the normal population. And the radiation-induced cancer is indistinguishable from naturally induced cancer. We can't tell which cancer comes from radiation and which comes from other mechanisms, such as pollutants and other things in our environment. And most cancers are increased. We knew this fairly early on when we were looking at nuclear testing, and we were doing things like this as marching soldiers down to ground zero, and I've testified for soldiers who had this and developed cancer later on when the government was not compensating them. Now they've passed compensation laws. And I know what these soldiers had in terms of monitoring their radiation, and it was nothing. You know, maybe one guy in a whole platoon of soldiers would carry a Geiger counter, but nobody else was monitored. And the radiation does not go spread evenly. You know, there are hot spots, cold spots, it's in dust, etc. And there was no internal monitoring of what they took in internally. We knew, of course, from our experiences in Hiroshima and Nagasaki, and we saw some startling pictures this morning, of the effects of that. 100,000 people died immediately from blast. And people ask me all the time, well, gosh, they rebuilt Hiroshima and Nagasaki. It can't be that bad. That's because the bombs were exploded about 1,000 feet in the air. And so this was a one-time dose of X-rays and neutrons, the gamma rays actually, and neutrons, like getting a big X-ray. There was very little fallout. There was some black rain, and we don't really know how much radiation was in that, but it really was a one-time huge X-ray that these people had. So we've been studying these folks since that time, or sometime after that. I last heard the cost of that study when I was at a radiation conference in the Ukraine after Chernobyl. And the cost at that time, which was about 15, 20 years ago, was $3.8 billion, B with a B, dollars for that study. And so I'm sure by now, and in today's dollars, it's probably $5 or $6 billion just to do those studies. Okay, lots of complex stuff they did. We went on and we learned more when we exploded nuclear weapons in many sites, including the Bikini Atoll. This is Castle Bravo, a hydrogen test. And unfortunately, at that time in the Bikini Atoll, there were fishermen from Japan on the Lucky Dragon, a fishing ship that was in the area. And the pulverized coral came up. And you can also see in this slide ships that were down here. And they tried to decontaminate those ships with high steam blasting, and they couldn't decontaminate it. They finally sunk the things. So I don't have much hope for decontaminating Japan, just like Chernobyl today. So the coral was pulverized in this, and it blew then downwind, and it blew over the Lucky Dragon, which was a a fishing ship. The fishermen went out and it came down for 3 hours and they were scooping this coral, radioactive coral, with their hands and throwing it overboard. And they didn't know what it was. And then they developed radiation sickness after this. So here comes the lying about this. The chairman of the AEC at that time, Robert Strauss, said that these injuries they had, the radiation injuries, were from the abrasiveness of the coral and not from radiation. And then the story developed. He told Eisenhower's press advisor, who announced it to the public, that the communists from Russia had taken over this ship, and they were there spying on our nuclear weapons program. And so this was the reason they were there, and they shouldn't have been there. So these are the kinds of, again, lies and cover-up that are so characteristic of the nuclear industry and have been throughout and continue today. Well, in addition, children on Rongelap, one of the islands in the Marshall Islands, were out playing in this snow that was coming down. They'd never seen snow. They thought this was snow. And so they got tremendous doses of radiation, as this young man who came to Bethesda had his thyroid checked, like many of the young children in Japan are getting today, their thyroids checked. Well, unfortunately, he died 2 years later of leukemia, I'm sure from this radiation, very small population of people. Well, what's happened in the Bikini Atoll? We know what it's like to clean places up or not clean them up because we've had experience with this, with these bombings. So we look in 1985 here, and this Bikini Atoll explosion was 1954. So we're 30 years later, and the islanders wanted to move back. So they scraped 17 inches of topsoil off, and then they planted plants there to see what would grow. And you can see the pumpkin in his left hand there, normal pumpkin, good jack-o'-lantern pumpkin. And you can see the deformed pumpkin grown in that pumpkin patch in the Bikini Atoll 30 years after that explosion. And you see the spike on the spectrophotometer, that's cesium in that pumpkin. And you also see that he has a lead-lined glove on that he's holding that pumpkin with. All right. So we've known for a long time. The government has kept this secret in many, many ways. So what do we think about the low-level effects of radiation? We know a lot about it, and a lot of arguments back and forth, and I'll talk about a couple of those studies in a minute. Dr. Alice Stewart, a brilliant epidemiologist, general practitioner, and then moved into epidemiology in England. She studied X-rays on fetuses and did great epidemiological work. She was a wonderful woman. I had her to Madison several times and visited her in England as well. And Alice discovered that one X-ray of a fetus in utero, and the fetuses are much more sensitive to radiation, as are women, than are adult males, which are all the standards that we talk about. You know, you can get 20 millisieverts or whatever. That's aimed for adult males. It has nothing to do with fetuses and children and women. All right, women are twice as sensitive as men to radiation, much more breast cancer especially. So Alice found that one X-ray in utero would increase the incidence of leukemia on that baby by 1.5 times. Now, when I started practice, longer ago than I care to remember, and I've done a lot of deliveries. At that time, we would do X-ray pelvimetry on women. They'd come in labor and having a hard time, and so we'd say, oh, get some pelvimetry. My partner Mary probably did many of these pelvimetries back in her day as an X-ray tech. And so it was a large dose of radiation right to the pelvis, right to this fetus. Worthless X-rays really told us nothing about could this baby really fit through the pelvis. And we still do those same types of things with other studies today that I'll talk about if you wish in the panel. And so here were women getting routine. How many X-rays you do with pelvimetry routinely? 2 or 3 X-rays right to the pelvis. And so these babies were getting this. Medical X-rays are probably the biggest source of radiation for all of us in the United States and maybe some other countries, not in underdeveloped countries. One individual in 1,000 will develop cancer from a 10 millisievert exposure with a CAT scan. I had a lady in the other day with irritable bowel syndrome, 38 years old, something like that, and I looked through her chart, and in my electronic records, I could see she'd had 8 abdominal CAT scans. Every time she'd go to the ER with abdominal pain, she gets a CAT scan. Every one of them was normal. And she said, well, I've been to Iowa and Minnesota, and I've been to hospitals there, and I've had CAT scans there as well. I said, you need to stop having CAT scans. Okay. Tremendous dose of radiation and increases her chances because radiation doses are cumulative. It's not like you just get this X-ray and then you're fine. It's like it accumulates time after time after time. Okay. But it doesn't just happen that way. It's leakage of radiation is happening throughout the nuclear fuel cycle. From the time we dig it up out of the ground, the uranium mining, converting it, which takes a lot of electricity, a lot of water for the mining and whatnot, enriching it, conversion to fuel, the diversion to nuclear weapons, like Rocky Flats, where we have contamination with plutonium and other elements years later, into reactors, leaks from reactors, big leaks, little leaks, that little leak that does no harm to human health. But again, it accumulates time after time after time. How many of you have any idea how many X-rays you've had in your life? I'm a doctor. Some of you may, because you may not have had a lot of them. Is that correct? All right. I've had enough and more than enough. Dental X-rays, etc. And two recent studies about that. One was in women with dental X-rays. They had lap shields on. They got dental X-rays early in pregnancy, many of them before they even knew they were pregnant. And they had lower birth weight infants than women who did not get dental X-rays. Okay? And we think it's because of the X-ray to the woman's thyroid affecting the thyroid and the growth of the fetus. Good study. And then a second study that just came out a month ago looking at dental X-rays and the incidence of meningiomas, which is a benign intracranial tumor, showing a higher incidence of meningiomas in people who get more dental X-rays. So, even that, which my dentist assures me is just fine, no problem, but it all adds up every time you get it. And so in addition to that, you get this exposure throughout the nuclear fuel cycle and finally to the waste storage, which we have no idea what to do with the waste. And believe you me, France doesn't, Norway doesn't. Norway's trying to build a big repository in a granite mountain. Nobody has the answer to this, and I don't know that we will. So looking at the mining in this country, uranium was mined, and most of these things, like in Australia, in India, my colleague was just telling me that he goes to India and measures radiation levels in the mining industry in India. And they're in indigenous areas. So many of the miners were Indians down in Arizona. This is a venting of a mine, blowing the air out of the mine, because we know there are high levels of radon in these mines, like there are in some basements, and it has to have a fan to blow it out. Well, the nuclear industry fought for years to prevent having to vent these mines, because it would add the cost of about $1 to a ton of uranium. And then finally Congress got enough pressure and they passed a law that they had to vent these mines. So this mine is being vented near a schoolyard, and so this is the kind of thing that happens. Tailings, tons and tons of ground up rock the uranium's extracted from, but this is still radioactive. And so huge mountains of it that we have no idea what to do with. Animals burrow in it, it erodes. Rio Puerco was an incident in Arizona where a state-of-the-art dam that was holding a tailings pond, the water that they used to wash this stuff out with, broke and ran down the Rio Puerco River and contaminated it. And animals and people were taking water out of the river. Have we followed up any of that? No. So it goes through the environment and it accumulates and it moves up the food chain. And it moves up the food chain to us. We are at the top of the food chain through the grass, through the cows, through the milk. When Chernobyl went up, we had radioactive milk. We had radioactive iodine in our milk in Wisconsin. Did we do anything about it? No. Didn't hand out iodine to kids. We didn't do anything about it. I was in Germany, in Marburg, Germany, shortly after Chernobyl went up, doing a speaking tour in East and West Germany, which was an interesting experience, because in West Germany, people were talking about it. In East Germany, nobody knew anything about it. So anyway, the mayor of Marburg came up to me after my talk, and he said, "What should I tell my people?" he said, I don't know what to say. The next county over, they got the cows out in the fields. We've told our farmers to keep the cows indoors because of the radioactive iodine. And he said, my nuclear people tell me one thing, it's not a big deal, don't worry about it. My medical people tell me another. Some of the activists tell me another. I don't know what to say. And he said, we've measured on sidewalks where there won't be much radiation. Then we come to a puddle, and there's very high radiation in the puddle. Now, I think about it, and I think, gosh, little kids, what do? They come and they jump in puddles, don't they? And so kids get this. They're also closer to the ground, and so they get more exposure this way. And they're more sensitive to radiation. All of this stuff that we just don't even think about as we do this. Well, it moves up the food chain, and we're currently seeing that. One of the slides this morning talked about the worldwide level of cesium at 3 microsieverts per kilogram, I think, was the level. Anyway, from nuclear testing. But it's a bit deceiving because, and then 5 in some areas, and then Chernobyl raised that, obviously. A bit deceiving because we may generally have that level, but for example, in Germany and France, you kill a wild boar, you have to have it tested for radiation because wild boars eat funguses, they eat mushrooms, truffles and things. And so they accumulate more radiation. So many of the wild boars that are shot in those countries have to be disposed of as nuclear waste. In England, there are still sheep farms 26 years after Chernobyl where they can't eat the meat of the sheep because there's so much cesium because they're eating the grass that's concentrating the cesium and bringing it up. So it doesn't matter what the general level is, you're seeing this concentration up the food chain, and again, we are at the top of the food chain, and our kids are. And there are lots of isotopes. It's not just cesium. The I-131 is the for thyroid we worry about. And when you think about the half-life of this, 8 days, you really have to take that times 10 to get it down to a level where you don't have to worry about it anymore. Strontium, cesium, plutonium that lasts much, much longer. Natural disasters have a beginning and a middle and an end. This is quite different from radiation. Radiation contaminates, it befouls, it penetrates, pollutes, unseen and silent. You can't smell it, you can't feel it, and it frightens in new and special ways, and that dread lingers on and on and on. So a number of radiation disasters in the world. The nuclear explosions that we conducted in the atmosphere for many, many years. Kishtim, 3 Mile Island, Chernobyl, and now Fukushima. Kishtim, a storage tank exploded, hydrogen explosion. 217 villages were destroyed. 10,000 people evacuated over 2 years. So many of those people were exposed to a lot of radiation. CIA knew about it. They kept it a secret, that secrecy thing. This is Hanford, and these are storage tanks much like the one in Russia that exploded. Radiation cloud moved 350 kilometers, contaminated 800 square kilometers, and it's still off limits today. This was 1957 that this happened. And I drove through there. We went up to Chelyabinsk to look at the nuclear weapons industry there, and there were these beautiful trees, looked like northern Wisconsin, with signs on them that said, "Don't come in these woods, it's too radioactive here." And then you'd drive along and there'd be a field with stuff planted. And I said to the guide, how can they plant crops there when the woods are too radioactive for anybody to enter? The animals don't read the signs, of course. He said, oh, we have to eat, so we grow the crops here and we ship them to other areas and we mix the crops together and dilute it down that way. We laugh, but that's happening in the Ukraine, and I'll bet you dollars to donuts. If I were Mitt Romney, I'd bet somebody $10,000, but that's probably happening in Japan today, the same thing. When we look at the cloud of cesium that came out of Chernobyl, it doesn't spread evenly, and depending on how the wind blows, and this is true of the Japanese stuff too, it's like this sort of evil undulating wave that moves all around and deposits different amounts of cesium in different places. It was picked up in Sweden first because nuclear power plant workers coming out of into the plants were setting off the alarms because they had radiation on them from the atmosphere rather than anything they picked up in the plant. And fortunately, thanks to heroic efforts in Chernobyl, this was covered up and stopped ultimately. But it went worldwide. They had to dig up lots and lots of soil. This is sand around the plant. I visited hospital number 6 a month after the accident. This was an engineer who subsequently died. His blood count was near 0 at this point. He's bronze because of liver failure, burns on his legs from radiation wafting up his legs. Another patient we saw, a fireman, with these are radiation burns on his leg, and they were in life tents. Many of them received bone marrow transplants. Bob Gale went over there, a surgeon. Arm & Hammer flew him over, big to-do about it. At a radiation conference that I was at in the Ukraine, they said that they felt that the men who received bone marrow transplants actually did worse than the other patients did. So we really can't help these people in this situation. A lot of conflicting data about how many deaths have occurred from this. The WHA, 56 deaths, maybe 4,000 eventually, all the way up to estimates of 1 million deaths already. We're not following the 800,000 liquidators who went in there and cleaned the thing up. Some interesting stories about that. Chernobyl today is still a mess, and the levels of strontium in the soil have dropped off as we predicted 26 years later. The levels of cesium in the soil have stayed the same, and in some areas gotten higher. We don't know why, what's happening. These trees are trees that the inner part, of course, was prior to the Chernobyl accident. The outer rings are post-Chernobyl. So we're often very arrogant when we talk about human effects of this, what it does to us. What is it doing to the ecosystem at the same time? So a very recent study on Chernobyl barn swallows, very good study, just published 2 weeks ago. And it showed that the reduced adult population by 43% in barn swallows. Barn swallows don't migrate. They stay in the same place. So they looked at yearling barn swallows, which is when they mate. And they found that males were reduced by 24%, but females were reduced by 57%. You remember I said that females are much more sensitive to radiation, and it applies to barn swallows as well. So they estimated from the pollution in the area that there was an excess annual mortality of about 1.8 million birds annually. And this is going to happen in Fukushima. It's going to happen everywhere where this is going on. This is an excellent study. I invite you to read it. So they built a huge sarcophagus. Here you can see me standing in front of the plant. Now they're having to build another one over it at the cost of $16 billion or $18 billion. This one's supposed to last for 100 years. We'll see. Who's going to replace it in 100 years? Then Fukushima happened. Beautiful plant right on the ocean. And here you can see the wave coming in. There's the tidal wave coming in. These are the generators, and here you see the water coming into the generators, and that shut the plant down, shut off the cooling systems. As a result, we had the explosions. This one looks quite different from this one, and maybe we can discuss that in the panel a bit in terms of what that might mean. This one looks more like a steam explosion. This one looks more like a much bigger explosion. That's the second one. Plant was devastated. These are the cooling rods that we were talking about in the reactor. And they're packed in there tight. And so it may be that some of them gotten bent or damaged. It's going to be hard to get them out of there. We don't know how to get them out. And that's going to be a huge job in addition to getting into the reactors themselves, which have certainly melted through. Nuclear power plants in the U.S., 104 of them. 11 in Illinois. Illinois has more than any other state. And we have lots of these fuel pools like this. And they look just like this. They don't have any covers, no containment vessel on them. I think they're an ideal target for terrorists, frankly, because it would be much easier to hit them than it would be to hit the containment vessel where the reactor is. And they have much, much more pollution in them. If the water goes at them, the rods heat and they catch on fire, then that smoke goes up into the stratosphere and hurts us all. But the single biggest danger, that's the power arm of the nuclear industrial complex, is nuclear weapons. And that threat is bigger than ever. Despite the fact that we're decreased in numbers of weapons, the Cold War sort of still goes on. Russia the other day threatening to attack our ballistic missile stuff in Europe. But we just released a paper in PSR, go to our website and look at it, on a limited nuclear war of 100 weapons between India and Pakistan. And they have about 200, 280 weapons between them. And they came very close to this in 2000 and 2006, twice. And 100 weapons would create smoke that would go up into the stratosphere and circle the globe in 4 to 5 days. And it would create a global cooling then, a sudden drop in temperature. It's the answer to global warming, I guess. And that smoke would stay in the upper atmosphere for up to 10 years, and it would create freezing temperatures in the northern hemisphere all year round for up to 10 years. Agriculture would collapse, and we estimate over 1 billion people would starve to death. Many other ramifications of this, obviously, in terms of what would happen to society. And yet we have 20,000 nuclear weapons with the equivalent force of over 200,000 Hiroshima-sized bombs, 10 billion tons of TNT, 2 tons for every human on the planet. And thousands of them remain on hair trigger alert. The president has this guy walking around with him with the suitcase all the time that's made by Halliburton, by the way. And, you know, in the event of a nuclear attack or a rocket launched, as Yeltsin found out in a warm day in November one year, and they saw a rocket coming out of Norway, and the command system in Russia alerted Yeltsin that there was this unknown rocket, maybe an attack. We're told that he actually opened the suitcase, and they have a little card of codes, at least our president does. You know, if you want to launch 3 missiles, press this button. If you want a full-scale attack, press this button. It's just that simple, because he's got 12 minutes to make this decision. So we don't know why Yeltsin didn't do it, but he didn't, and it turned out this was a weather satellite being launched, and we had told the Russians we were going to do this, but it somehow didn't filter up the system, communications again. So here we are with our president with his finger literally on the button, able to destroy civilization through global cooling or all of the nuclear war. One Trident submarine has more weapons power on it than India and Pakistan have. And yet we did this scenario with India and Pakistan. That's the sword of Damocles that we're living under as part of the nuclear industrial complex. And we should all be very, very concerned about this as the nuclear weapons establishment gets refurbished, new plants being built, new bombs being made. We're in a horrible situation here, and we have to change it. We can prevent nuclear war. We have to do it, and the way we do it is to get rid of all nuclear weapons. That's our goal. So remember the hallmark of the nuclear industrial complex: secrecy, cover-up, and minimization. As you look at what's happening in Fukushima now, because that's what the Japanese government does, because they're in bed with the nuclear industrial complex. It's what our government does. It's what the Russians do, and you can be sure the Chinese and Indians and Pakistanis are doing that, and certainly the Israelis. That's the characteristics of this. Don't lose sight of the forest for the trees. Don't get into arguments about a little release of radiation or this small dose or what it does, because that's the tree, and you can get totally bound up in that in arguments with people. The forest is that we are blanketing the earth with unknown amounts of radiation multiple times over and over again that's going to go on for centuries to come. We're doing this with an unknowing and unconsenting population worldwide. We're all being affected by it, whether it be from bombing, from leakage, from accidents, from waste, or from the medical community. This is the reality of what's happening with us in radiation today. And so we all have to learn more about it and stop this process by closing down nuclear power plants and by getting rid of nuclear weapons. We're not going to know the results of this experiment that we're conducting today, which I think is unconscionable at best, for centuries to come. Our children and grandchildren and their children are going to inherit this from us. It's an awful, awful legacy that we're leaving them. So we're at a fork in the road, maybe past the fork, I don't know. Einstein said the splitting of the atom has changed everything save our modes of thinking, and thus we drift toward unparalleled catastrophe. Educate yourselves. Dave's organization, the NEIS, and other organizations, great groups to join and read about and become active. The only thing you cannot do is nothing. Thank you very much. We have a beautiful planet.